So I am now on to the hip portion of the practical. I'm first going to start off with the palpitations of the bone. So the greater trochanter is going to be the top part of the femur, and you'll be able to feel it. It's going to be right there. And then the lesser trochanter is going to be down farther. Right here. So your femur is obviously the big muscle or big bone in your leg that goes up and connects. So your pubis, your pubic symphysis, and your pubic tubercle. Your pubis is going to be the part that starts into your ischium and ischium tuberosity, and your pubic symphysis is where your pubic tubercles go and they connect by cartilage. And your ischium and ischial tuberosity are the parts on your gluteus maximus that you actually sit on. And then your ilium is going to be your hip bones. So hers are right here. And your anterior superior iliac spine, if you can just turn. So these are your anterior superior iliac spine, and your anterior inferior iliac spine are just going to be down a little bit. So anterior, superior, anterior, inferior, and then posterior is down. Okay, so next up are going to be our ligaments. So these ligaments are going to be the iliofemoral ligament, the pubofemoral ligament, and the ischiofemoral ligament. So the ischiofemoral ligament is going to be on the back. It's going to be on the neck of the femur, and it connects to the ischium. It's going to be on the back of the femur, so the head of the femur connects here, so it'll go onto the back. The ilio and the pubofemoral ligament are going to be the ligaments that connect to the front of the head of the femur, and they're going up to the ilium and the pubis. Next, we're going to palpitate the muscles and the tendons. So the first one is the iliopsoas. It goes from the greater trochanter, and this one's actually going to go up through the pelvic bones, which is going to be the ilium, and it connects to our back down low spines, the cervical spines. Next is going to be the sartorius, so that one is going to be on the front of our leg. So it's going to go from our greater trochanter, and it's going to go down and wrap down onto the medial portion of our knee, and it crosses the femur. Our pectineus, we'll come back to that. Our gracilis is going to be the muscle that's going to be on the inner portion of our thigh, so it's going to be the longest muscle going down, and it connects to the inside of our patella. We have our adductor magnus, longus, and brevis, so those are going to follow the gracilis, so it'll be magnus, and then longus, and then brevis. And then we have our gluteus maximus, which is obviously the biggest portion of our gluteus maximus, the biggest muscle. And then we have our gluteus medius, which is going to connect from our upper portion of our hip and go into the gluteus maximus. And our tensa fasciae latae, that's going to go from the bottom of our ischium, and it's going to connect and stop right into the middle of our femur. Our pectineus, I remember now. Our pectineus goes from the ischial tuberosity, and it goes down, across, and it'll connect down here as a tendon going across here. All right, so now we're going to be testing our manual muscle testing for flexion, extension, abduction, adduction, internal rotation, and external rotation. So for flexion, I'm going to have you go up into flexing your knee, and you're going to try and force your leg backwards as I'm trying to pull you down. Okay, it works very well. And then for extension, you're going to lay on your stomach. Okay, so you're going to try and raise your leg up as high as you can, and I'm going to force you down. Don't let me push you down, so put against the resistance. All right, so her manual muscle testing, I'd give it a grade 5. She's nothing wrong. It's all pretty well. So for abduction and adduction, you're going to lay on your sides. All right, so the first one, you're going to raise your leg up, and don't let me push you down. Okay, so I'm gonna give that a 4 out of 5. I could move it a little bit, but it was still pretty strong. And then for adduction, don't let me push your leg up. Oh, that one's 5 out of 5. Okay, so then now you're gonna lay supine, so you're gonna lay on your back. And now we're gonna test for internal rotation. So you're gonna bring your leg up and over, but don't let me push your leg down.
Oh, okay.
Okay. Okay. And then now don't let me push your leg outwards.
Okay.
Okay.
So how fair I did leg day.
So I first want to start off our special test for the hip by going about the Craig's test. So this one I would not be able to do at the moment just because I am home and you have to measure an angle. But this one you're going to have the patient laying supine and you're going to have their knee flexed at 90 degrees and you're going to internally and externally rotate their hip and their knee until you get their greater trochanter parallel to the placement, and then you would measure the angle with a goniometer from there. So our next test that we're going to do is our Thomas test. So this is going to test for your hip flexor tightness. So I'm going to have you bring up whichever knee you would like, and you're going to grab it, and you're going to pull it back as far as you can while trying to keep your leg touching to the table. So as you're doing that, your leg has not gapped, so you do not have any flexor tightness in that one. And then the Trendelenburg sign test is going to be one to test the pelvic tilt. So you would just have the patient stand on one leg and you would examine their tilt and see if their pelvic bone is tilting or not. So the next test I'm actually going to have to explain just because her hip is starting to bother her. So it's going to be the piriformis test, which is going to assess for tightness. So you would essentially just have the leg that you're testing with sit on the other leg and you would push that internally and see if there is any pain or any tightness in your piriformis muscle. So the next test we're going to do is the anterior labral tear test. So this one I'm going to move her into flexion and I'm going to internally rotate her foot and push in her knee. So it's going to be a little uncomfortable. But do you have any pain?
Nope.
Okay, so she doesn't have any pain, so she does not have a positive test. So next we're going to be performing the Patrick's test. So this one, the person would be putting here, and I would just press down on the knee and then press down on their upper opposite hip bone. And if she had any pain, she would have a positive test. So the next test is going to be the hip score test. So again, I will explain this just because she is having some hip pain. So this one, I would bring her into flexion and then I would put pressure down on her knee, which is going to cause any pain or clicking or grinding to test for compression forces and test for any tears in the labrum. So the next one is going to be the leg roll test. This is again just testing for any tears in the labrum. So you would just take both hands and you would literally just roll her leg back and forth like this, and if she were to have any pain, then there's a possible tear in her labrum.